Welcome to The Explainer. Today, we're diving into the world of sexual wellness treatments, and we're going to do this with some expert guidance from the Women's Health Clinic, really exploring who these procedures can help, but maybe even more importantly, we're going to get super clear on the safety warnings that tell you who should absolutely stay away. Let's kick things off with the philosophy that really guides this entire conversation. This quote from Dr. Farzana Khan, it just perfectly sets the stage for that safety-first, patient-first approach that is so critical here. So this really is the big question we're here to answer, right? It's a huge industry, but who should absolutely avoid it? We're going to cut through all that marketing noise and get right to what actually matters: your health, your safety, and making sure you have all the facts. Okay, so to really get why these safety rules are so important, you have to know who's giving the advice. So first up, let's meet the expert from the Women's Health Clinic, whose guidance is really at the heart of this whole explainer. So this is Dr. Farzana Khan, and her experience is pretty incredible. We're talking over 2 decades in medicine, a specialized diploma in sexual and reproductive health, but what's really key here, especially for her topic, is her role as a trainer for some of the biggest names in medical technology. This means she's not just doing these procedures, she's actually teaching other doctors the right and, most importantly, the safe way to do them. That's a huge deal. All right, with that level of expertise setting the scene, let's get into the procedures themselves. What are we actually talking about here, and why is that pre-treatment screening just so non-negotiable? So, we're looking at a whole spectrum of treatments. You've got energy-based therapies like lasers and radiofrequency. Then there are regenerative injections like the O-shot, and even specialized fillers. And look, while these can offer some amazing benefits, we have to remember these are all medical procedures, and that means careful, responsible patient selection is everything. Okay, now we're getting to the really serious stuff, the absolute non-negotiables. In the medical world, they call these absolute contraindications. Basically, they're bright red flashing stop signs for these kinds of treatments. The message here could not be clearer. It's just stop. If any of the things we're about to talk about apply to you, these procedures are off the table, at least until the issue is completely resolved and a specialist gives you the all clear. First on the list, any kind of active genital or pelvic infection. Think about it. These treatments work by creating a tiny, controlled bit of inflammation to kickstart healing. If you already have an infection, you're just pouring gasoline on a fire. It can make things so much worse. Next up, and this is a big one, pregnancy or breastfeeding. During this time, your body is just going through massive changes. Hormones, blood flow, you name it. It makes how your tissues might react completely unpredictable. And honestly, there just isn't the safety data. So for the health of both mom and baby, it's a universal no-go. Okay, this one is crucial: undiagnosed vaginal bleeding. This is a symptom, right? Not a diagnosis. And while it might be nothing, it could also be a sign of something serious. Any good ethical clinician, like you'd find at the Women's Health Clinic, is going to insist this gets fully checked out before even thinking about an elective treatment. And this one? Well, this one is just paramount. If there's any active cancer or even precancerous cells present, there's no discussion. The patient's safety and their cancer treatment plan will always come first. It's not even a question. All right, so we've gone through the definite stop signs. Now let's shift gears and talk about the caution signs. These are what we call relative contraindications. They don't automatically rule you out, but they mean you need to have a very careful conversation with your doctor first. So, as you can see, this list is pretty diverse. If you've got an active skin condition, that needs to be under control. If you're on blood thinners, that's a whole other conversation about bruising. And this is so important, your mental and psychological well-being matters too. A responsible clinic will always make sure a patient's expectations are realistic and healthy before moving forward. Okay, now for the really interesting part, I think. Let's talk about the hidden risks. These are the kinds of things that even a totally healthy person might have no idea could affect whether a specific treatment is right for them. So let's kick off with something super common, an IUD, or the coil. Millions of women have one. But here's the thing, whether or not it's a risk has everything to do with the specific technology being used for the wellness treatment. And this is just a brilliant example of why the details matter so much. A copper IUD is a total no-go for a magnetic treatment like the Emcella chair because, metal and magnets, it could heat up or even move. But for a laser treatment that only affects the surface, it's generally totally fine. This is exactly why you have to tell your clinician about every single medical implant you have. All right, here's another one that might surprise you. Let's look at how some really common over-the-counter supplements, things you're probably taking to be healthy, could actually mess with a procedure. So take a regenerative treatment like the O shots. The whole thing depends on the quality of your own blood, right? Specifically, its ability to clot and release all those amazing growth factors. But common things like fish oil or even aspirin, they thin your blood, and that can literally stop the treatment from working properly. In this case, your blood quality is, well, it's the whole shebang. Any procedure that uses heat or creates a tiny bit of trauma to the skin can actually trigger a herpes outbreak. It can happen even if the virus has been dormant for years and years. It's a known risk, but thankfully it's manageable. That's why this simple 3-step protocol is just standard medical advice. You tell your doctor, take some preventative antivirals before and after, and it helps keep you safe and comfortable. Okay, so now that you're armed with all this info, you know about the absolute stop signs, the caution signs, and even those tricky hidden factors. How do you actually take charge and make the safest possible choice for you? Let's be really clear. These are the absolute red flags. If you're dealing with things like unexplained pain, weird discharge, bleeding when you shouldn't be, or any new lumps, the answer is simple. Do not book an elective wellness treatment. Your first stop is your GP. These things need a proper medical investigation, period. And really, it all boils down to this one simple thing. A good, ethical clinic, like the Women's Health Clinic, will always, always put one thing first: your safety. Your health has to come before any sale, every single time. So we'll leave you with this final thought to take away. Before you ever ask, what can this procedure do for me? Pause and ask the more powerful question: is this procedure safe for me? Making that your priority, well, that's the most empowering thing you can do on your health journey. Thanks for watching.